Why are target antiemetics effective for CNS nausea? Imagine feeling queasy not because of a stomach bug but because your brain is sending confusing signals that make you feel sick. That's often the case with nausea caused by issues in the central nervous system, like brain tumors or other brain health conditions. To understand why targeted antiemetics work well here, we need to look at how the brain controls nausea and vomiting. The key player is an area in the brain called the area postrema. It acts like a surveillance center that detects toxins or signals from the body and then triggers nausea or vomiting as a protective response. When the brain or the body is disrupted, such as by a tumor pressing on certain areas, this system can become overactive, leading to persistent nausea. Targeted antiemetics are designed to block specific pathways involved in this process. One major pathway involves serotonin, a chemical messenger. During chemotherapy or other stimuli, serotonin is released from the gut lining and stimulates nerve signals that reach the brain. Drugs like ondansetron block serotonin receptors in both the brain and the gut, preventing these signals from triggering nausea. This is especially helpful when nausea is driven by signals from the gastrointestinal tract that are amplified by brain conditions. Another important pathway involves dopamine. Dopamine is another chemical messenger that can activate the chemoreceptor trigger zone in the brain, which then sends signals to induce nausea. Medications like metoclopramide work by blocking dopamine receptors in this zone, reducing nausea caused by gastrointestinal issues or medication side effects. There's also the neurokinin 1 pathway, involving a receptor called NK1. Drugs like aprepitant block these receptors, which are involved in the delayed phase of nausea and vomiting, especially after chemotherapy. Combining NK1 blockers with serotonin antagonists and corticosteroids can provide a more comprehensive approach to controlling nausea, particularly in complex cases like brain tumor patients. Corticosteroids such as dexamethasone are often added because they help reduce inflammation and cytokine releases, which can also contribute to nausea. They are used alongside other antiemetics to improve overall effectiveness. In cases of brain tumors or other central nervous system conditions, the normal regulation of nausea can be disrupted. Tumors pressing on or damaging parts of the brain involved in nausea regulation can cause persistent symptoms. Using targeted antiemetics that block these specific pathways helps manage this type of nausea more effectively. Combining drugs that block serotonin and NK1 receptors can inhibit the activity of neurons in the brain that promote nausea, reducing the sensation and making patients more comfortable. Research is ongoing to find new targets for treating CNS nausea. Scientists are exploring receptors like GIPR, TRPV1, and GLP1, which influence nausea signals in the brain and gut. These emerging options could offer hope for patients with stubborn or resistant nausea in the future. Overall, targeted antiemetics work because they precisely block the pathways that send nausea signals to the brain. This specificity makes them more effective in managing nausea related to brain health issues, especially when traditional treatments fall short. Remember, if you or someone you know is experiencing persistent nausea, it's important to consult healthcare professionals who can tailor treatment plans based on individual needs and underlying causes.